Welcome everyone to this super exciting Neuroslimming webinar on clarifying cholesterol controversies. And the reason this is so important is because cholesterol is very, very misunderstood, and yet it plays a really critical role in our health. So I can't wait to launch into this and clarify it for you. And when I said in my invitation that at the end of this, you will know more about cholesterol than the average doctor, health professional, even some cardiologists, I was not kidding. But before I dive in, I'll introduce my Chief Education Officer, Craig Bulmer, who will just quickly talk you through the icons, how to ask questions while I'm talking, and the fact that there's going to be a few poll questions. So actually 10 poll questions. Over to you, Craig.
Thanks, Helena. Welcome back, everybody, to webinar number 10. Again, another exciting one on a very hot topic, cholesterol. So looking forward to that. As you all may know, and if you don't, I'll tell it to you now. Down the bottom of your screen, you'll see a thing, an icon, looks like an emoji with a plus sign that says reactions. If you click on there at any time, you can raise your hand, give it a love heart, have a bit of a laugh, thumbs up, whatever you think is appropriate. And also throughout the night, I will be putting up some questions or some polls, and I'll give you kind of 25, 30 seconds to fill them out, and then I'll share the results as we go through that. And there's 9 of them to do with a topic, and then a 10th one just to get some feedback of what you thought of the night. So without further ado, enjoy. Just please stay on mute if you can. That would be wonderful. You can use the chat button if you need to as well, and I'll be answering anything there I need to for Helena, or I'll interrupt her if need be. But other than that, we're in your hands, Helena.
Thank you. So thank you firstly, everybody, for I've got so many questions on this, and I have planned to get through all of them. And I want to congratulate you on the depth and thoughtfulness of your questions, because it really tells me you're thinking about this. And this is just a big overview of what we're going to cover. Now, there is a lot of misinformation out there. So I just want to pose a question: why should you trust me? I have really, really researched and studied this topic for the last 10 years. And it all started with my father being diagnosed with Alzheimer's disease, and all the literature and all the doctors and all the neurologists saying midlife cholesterol increases your risk of Alzheimer's disease. So both of you should be chock-a-block taking statins every day. And then when I looked at the literature, some studies found that statins, they're the drugs that lower LDL cholesterol in your blood, which is labeled as the bad cholesterol. More on that later. Some studies show that statin drugs actually impaired memory. So I thought, what on earth am I going to do? That launched me into a decade-long study of cholesterol. And anyone that tells you cholesterol is a simple matter has no idea what they're talking about, because the more we know about cholesterol, the more we realize there is to know. So this is what I'm going to cover. What is cholesterol? What is good versus bad cholesterol? Because I'll bet you most people don't even know what cholesterol is. What raises bad cholesterol? What tests should I have? Are there any supplements out there that help? And that final question that was most relevant to me, are statins good or bad? So I'm just going to ask you, this is not a poll, I just want you to think about this. Which organ contains the most cholesterol? If you want to type in an answer, and then Craig can read them out. So what organ do you think contains the most cholesterol? If you get any answers, let me know. Otherwise, in 10 seconds, I'll tell you.
No one's brave enough yet. The liver, arteries.
I can see why you've picked those. However, the brain that contains the most, this is the brain, the organ that contains the most cholesterol is our brain. Our brain contains about 25% of all the cholesterol in our body. So one would wonder whether lowering cholesterol is a good idea. So that's a question I will answer, as will I answer, do statins impair memory? That's the starting point. Now, this is a real poll. Craig, could you put the first poll up? What is the leading cause of death, in Western societies? Well, in the world, actually. What is the leading cause of death? Okay, very good. The answer is, in fact, cardiovascular disease, which includes both heart attack and stroke. It's responsible for about a quarter of all deaths worldwide. And most people are surprised to learn that more women die of heart disease than they do of breast cancer. Okay. Immediately, I'm going to move on to the next poll question. Does bad cholesterol cause heart disease? Is a bit strong. Is the bad cholesterol, which I'm about to define, a contributing factor to heart disease? Yes or no? Or I don't know. Yes. The answer is, most of you are correct. The answer is yes. It does contribute to heart disease. And that is why cholesterol is such an important topic, because it's a contributing factor to the leading cause of death worldwide. Okay, so what is cholesterol? Cholesterol, and there's a reason I put those two superheroes there. Cholesterol is a molecule that is made by every cell of our body, and it is absolutely critical to both the functioning and survival of every cell of our body. It's also used in the production of hormones like estrogen, progesterone, testosterone, adrenal hormones, also in the synthesis of vitamin D, and in the production of bile acids, which assist in the digestion of fat. But cholesterol just is so important for our cell membrane. So really, it's just absolutely critical to survival and functioning of every cell. If we didn't have any cholesterol in our bodies, for some reason, it was sucked out of our body, we'd be dead. So that's how important it is. Now, the question that plagues everyone, is there good and bad cholesterol? The short answer is no. All cholesterol is the same. The reason there are labels good and bad is the following. Cholesterol does not dissolve in water. It's like a fat. So you know how fat doesn't dissolve in water. So in order to travel through the blood, which is essentially a water-based substance, cholesterol has to be carried in transport proteins. And there are many different transport proteins. And these transport proteins are called lipoproteins. And there are many different types. So every time you hear the word lipoprotein, think of car carrying a passenger, which is cholesterol. Now, lipoproteins don't only carry cholesterol, they also carry triglycerides and phospholipids. So there's some ride sharing going on, but don't worry about that for the moment. Just think of cholesterol is carried in proteins called lipoproteins, and these are like cars, whereas cholesterol is like the passenger. So can you see the passenger is the same? What people are labeling good or bad is the car. Okay. And I mentioned that there was some ride sharing going on. There are different lipoproteins. They are called LDL, HDL, VLDL, IDL. Right. This is an important slide. So just like there are different cars, there's Volvos, Mercedes, Alfa Romeos, there are different proteins carrying cholesterol. The ones you'll hear most are LDL, which stands for low density lipoprotein, and it's been given the label bad. You'll also hear HDL, high density lipoprotein. It's been given the label good. You don't hear much about IDL, intermediate density, and VLDL, very low density. So as the name suggests, they're classified according to how dense they are, how heavy they are, if you like. You don't hear much about IDL because it only lasts in the blood for a few minutes. You don't hear much about VLDL because it only lasts in the blood for a couple of hours. But IDL and VLDL are also under the label of bad cholesterol because they can also contribute to plaque, atherosclerosis in artery walls, which is what can contribute to heart attack. Now, the reason LDL gets the most attention is because it is the one most likely to crash into an artery wall. Okay? But it is that's basically the problem. If anything's going to crash into an artery wall, it's going to be an LDL, much more likely than any of the others. And depending on which artery it crashes into, and if there ends up being a big pileup, you'll have a heart attack if it crashes into and causes a blockage in an artery, in a coronary artery to the heart. If it affects an artery to your brain, you'll have a stroke. HDL is given the label good cholesterol because it operates like a tow truck or a fire engine. So not all crashes are going to lead to big pileups. Our immune system, lots of molecules there, macrophages you might have heard of, and our HDL vehicles rush in whenever there is a crash to try and clear up the debris, to try and remove that cholesterol from the artery, or to try and dampen down the inflammation that is a natural response to damage to our artery wall. That's why HDL is given the label good cholesterol. But can you see the cholesterol in LDL, VLDL, IDL, and LDL is all the same cholesterol? It's just the vehicle that's different, and some vehicles are more likely to crash into an artery wall than others. And it's the LDL, IDL, and VLDL that are likely to crash. HDL cleans up the mess. I am simplifying this, but that's basically how it works. Okay, and sometimes you'll get a pileup of cars and sometimes you won't. It depends on whether or not HDL and the other anti-inflammatory molecules and the immune system can get in there and clean it up quickly enough. So let's bring us back to, what does cholesterol do in the brain? Cholesterol is absolutely essential for the communication between brain cells because it forms a big part of the myelin sheath that surrounds the long axons, the nerve fibers that allow for electrical transmission. It's also important for energy production in the brain. So our brain, absolutely, without cholesterol, we couldn't think, we couldn't operate, nothing would happen. So does high cholesterol in blood mean high cholesterol in the brain? The answer is no. There is no relationship between your blood cholesterol level and the amount of cholesterol in your brain, because the cholesterol that I'm talking about in your brain is in the actual cells of your brain. And they're two separate systems. Your brain does not get any cholesterol delivered to it from the blood. Your brain makes its own cholesterol. Your brain also does not get any cholesterol from what we eat because it's way too important. The brain isn't going to let us and our fickle food choices determine whether it gets enough cholesterol. No way. The brain makes its own cholesterol. The brain regulates its own cholesterol within its cells. And the reason there is no delivery of cholesterol into the brain from the blood is because of an entity called the blood-brain barrier. It's like a brick wall that separates the circulation in the rest of your body from the circulation in your brain. It allows only a few essential molecules through. And this is essential because you don't want bacteria, viruses, toxins in your blood being able to diffuse into your brain. It makes it tricky when you're trying to create anti-Alzheimer's medications because things don't get through. But for the most part, thank goodness this barrier is there. So that's why, don't worry, blood cholesterol does not reflect brain cholesterol. So let's ask the next question. Does eating cholesterol raise LDL, bad cholesterol? Even though I hate the terms good and bad, but I'm just using it as shorthand. So does eating cholesterol raise LDL cholesterol? Yes, no, I don't know. Very interesting. The answer is no. Eating cholesterol does not increase blood cholesterol, specifically LDL. And I know that anytime you go to the doctor and your cholesterol, bad cholesterol is high, they will tell you not to eat, to lower the cholesterol in your diet. Let's first look at what foods contain cholesterol, and then I will explain to you biochemically why eating cholesterol doesn't raise cholesterol. 75%, by the way, couldn't remember what order my slides were, 75% of the cholesterol in our body comes from what we make ourselves. That means only 25% comes from what we eat. But here's the thing. If you eat a lot of cholesterol, your liver, your cells are going to go, holiday, I don't need to make it. If you eat zero cholesterol, if you're a vegan, your cells will make more cholesterol because it's such an important molecule. Our body self-regulates how much cholesterol it makes. So before I explain why it doesn't change, why what we eat doesn't, you know, in more detailed terms, let's just work out what foods contain cholesterol. So you know you don't have to be afraid of them. Is cholesterol only found in animal foods? True, false? I don't know. It's true. Cholesterol is only found in animal foods. Now, if we're going to be really precise, plants make phytosterols, which are related to cholesterol, but they're not the same molecule. So whenever you see an avocado, a nut, a plant food labeled cholesterol-free, it's like, duh, plants don't make cholesterol. So which foods then are rich in cholesterol? There is a list and you can pick more than one. Okay. The answer is all of them except egg whites. So meat contains cholesterol. Offal, like brain, liver, those two contain the highest amount of cholesterol. Poultry, it's egg yolks, not egg whites, that have cholesterol. And that's why there was this craze of egg white omelets going around a couple of years ago. Yes, cheese, and yes, prawns and other shellfish tend to and have a reasonably high cholesterol. Okay. So why are we being told to eat less cholesterol? Because it sounded logical in the past. If you eat cholesterol, then you're likely to have high blood cholesterol. Why wouldn't you? I'll tell you why you wouldn't. Cholesterol comes in two forms. I want you to take your hand. Now, in one form, cholesterol is called the free form, the active form, and it's like your open palm. I actually want you to have your palm open so you really understand this. The other form that cholesterol exists in is called the storage form. I want you to pick up a pen. Just pick up a pen anywhere or a pencil or something and make a fist. That is like the storage form of cholesterol. It is given a name. It's called a cholesterol ester, E-S-T-E-R, or esterified cholesterol. So free cholesterol, esterified cholesterol. Most of the cholesterol in the food we eat is esterified. And this is bulky, like this is flat. It could squeeze sort of through little spaces. This is bulky. So in order for us to absorb the cholesterol, our pancreas has to make enzymes to open it up, take off the ester, and then we can absorb it. That takes time. By the time the pancreas makes the enzymes that are required to de-esterify cholesterol, that's the terminology, we've excreted most of the cholesterol in our stool. Nonetheless, we do absorb, we might absorb about half of the cholesterol that we eat. But even then, our body is really good at regulating the cholesterol that we need. So there's two reasons why the cholesterol that we eat doesn't affect our blood cholesterol. One, because half of it we can't absorb and it's gone out in our stools. And number two, if we do absorb it, and there is a small percentage of the population that are called hyperabsorbers. Some people just absorb more cholesterol than the rest of us. It's a genetic thing. But even so, for the majority of people, eating more cholesterol isn't going to make any difference because we will just down-regulate the amount we produce. Okay. One person said, do we absorb more cholesterol as we age? That's a really interesting question. Studies have found that women after menopause do absorb a little bit more as they age, but men tend to absorb less cholesterol as they age. So it's not really a big issue, but somebody asked the question, so I'm answering it. So if eating more cholesterol doesn't raise blood cholesterol, then what does? Next poll question, please. Okay, the answer is all of them. Too much sugar, too many soft drinks because of the too much sugar, too much saturated fat. Now, I'm going to put that in brackets. In some people, too much saturated fat raises cholesterol. In other people, it does not. So this is another case for one piece of advice does not suit everybody. So what foods contain saturated fat? Once again, only animal foods. And this is probably one of the reasons that we made the mistake of thinking eating cholesterol raises cholesterol, because many foods that are high in cholesterol are also high in saturated fat, not everything. And in a percentage of the population, high saturated fat diet raises LDL cholesterol. So what contains saturated fat? Meat. Somebody did ask me, does meat make a difference? It depends, fatty meat. It depends whether you're one of these people that eating saturated fat raises your cholesterol. How will you know? Trial and error. We don't have a test that can tell you that. You'll just have to see whether eating more saturated fat raises your cholesterol or not. Most doctors would just tell you don't. But personally, I think trial and error, because it's way more important. Oh, sorry, I haven't finished what contains saturated fat. Your meat, the fat on your meat, dairy, butter, cheese, animal foods basically contain saturated fat. But it's way, way, way more important and effective to lower all the other things. Now, the sugar, remove the soft drinks, remove the refined carbohydrates. What else did I put up there? Too much alcohol. And people will go, but hang on, I heard that drinking alcohol raises the good cholesterol. The thing was too much alcohol, and that's because it can affect liver function, and the liver produces cholesterol, the liver clears cholesterol. So it's important not to have liver disease if you want healthy cholesterol levels. Okay, next question. What else raises LDL cholesterol? So there's some of the foods. Now, what other things raise LDL cholesterol? Another poll. The answer is all of them. Why? Too little dietary fiber, because a high fiber diet reduces our absorption of cholesterol even further. So it can help in there. And it can also, basically, I'll just leave it there. I'm not going to make it more complicated. So yes, if you don't eat enough fiber, your LDL cholesterol can go up. Yes, too little exercise, you all know that. Too little sleep, because it elevates hormones which increase LDL cholesterol. So that's how sleep works. And smoking does as well, but we're not 100% sure of the mechanism, but there's a clear relationship. Thank you. Next poll question. We've got one more. What else raises LDL cholesterol? All of them. You should be used to me by now. Side effects of steroids and quite a few other medications. So when you are prescribed any medication, always ask your doctor, can this affect my cholesterol levels? Diabetes is a huge cause of raised LDL cholesterol, and also triglycerides, which are also a fat that increases the risk of heart disease, chronic kidney disease, and underactive thyroid. Why? Because you need your thyroid hormones to help regulate your cholesterol. So even if your thyroid is only underactive by a very small degree, it can still bump up your LDL cholesterol. So please, if you just can't work out why you've got high cholesterol and you're feeling a bit sluggish, tired, thinning hair, feeling the cold a lot, get your thyroid tested. It's a simple test. You might as well get it checked. Thank you, Craig. Okay, so I did talk about how the thyroid gland raises LDL cholesterol, because if you're not producing enough thyroid hormone, you're not clearing your cholesterol from your blood properly, the LDL from your blood. Okay. Why then are some people saying you're going to hear that LDL cholesterol does not actually matter? This is where things get a bit complicated. So let me explain. I want you to think of the following analogy. Your artery is like a road. And remember, your LDL, HDL are the cars on the road. So I'm just reminding you of the analogy. Cholesterol is the passenger, lipoproteins are the cars. LDL cholesterol is the car carrying cholesterol that tends to have accidents. Now, let's just look at the road for a moment. I want you to forget arteries. I just want you to think about road accidents. What causes road accidents? We're just looking at the characteristics of the road at the moment. We're not looking at bad driving or anything like that. But just, would you agree that if you've got a poorly maintained road, if you've got bad weather, and if you've got a lot of cars on the road, this is going to increase your risk of car accidents? Please nod. Okay. The similar thing happens with your artery walls. Regardless of how much cholesterol you've got in your blood, smoking, high blood pressure, high blood sugar, high blood insulin, high uric acid, high few other things, damage artery walls independently of cholesterol. So it doesn't matter how good a driver you are or how good the car is. If you've got a really bad road, it's just going to make accidents more likely. So that's one reason why people are going, well, does cholesterol really matter? Is it the state of the road that matters more? Everything matters, okay? But let's just start by saying if you've got damaged arteries from other reasons, it's going to make it more likely that there is a crash. I mentioned bad weather as well. Now, people are quite shocked by this, but emotional distress increases your risk of a stroke more than smoking. Depression increases your risk of a heart attack more than smoking. Our emotional health damages our arteries. It stiffens them, it hardens them. So in addition to physical things, these things, emotional distress and chronic major untreated depression. It's not just a bout of depression. It's not grieving because somebody's died. We're talking years and years of chronic major depression will also increase your risk of artery disease, heart attack and stroke. And the final thing we agree, I'm sure we agree that if you've got more traffic jams, then you're going to have more accidents just because of the nature of more cars, more accidents. So what increases the number of cars on the road? One thing that is, so now we're talking about the number of LDL cars. There is a condition called familial hypercholesterolemia, FH, in which the liver is just not able to remove cholesterol, LDL cholesterol from the blood as well as it should. It's just missing some receptors. It's like there's not as many gates allowing the LDL cholesterol in. So they just tend to have high LDL cholesterol. It occurs in about, people go between 1 in 200 and 1 in 500 people. So I've just said 1 in 300 people. It is a genetic mutation. And if one of your parents has familial hypercholesterolemia, there's a 50% chance that you will inherit it. But these people just tend to have high cholesterol from a young age. And if it's not picked up and treated, they will have a heart attack or stroke at a young age, meaning, under the age of 50. But that's the minority of people. So let's just go back to the tests that are ordered and whether they matter. You're probably going to have a better idea of the answer here now. What do your blood tests mean? Total cholesterol means all the cholesterol added up in your, the amount of cholesterol in your blood, which is the LDL cholesterol, the HDL cholesterol, the VLDL cholesterol, the IDL, it's all of them added together. And quite frankly, total cholesterol is a meaningless test. If you've been told you have say you've got a total cholesterol of 7, well, does that mean you've got 3 LDL and 4 HDL? And a bit of that, like, which one's high? I don't know. So total cholesterol is meaningless. I don't know why we're wasting our time. LDL cholesterol is quantifying how many passengers are in all the cars. So we're not counting the cars, we're counting the passengers. So you might have 10 cars, each carrying 3 passengers, in which your cholesterol would be 30. Or you might have 20 cars, each carrying 1 passenger. No, 15 cars, each carrying 2 passengers, in which case you'll also have a cholesterol of 30, but the reason will be different. One will be because you've got more cars, and the other will be because you have more passengers. Is that clear? Okay. And HDL cholesterol is just adding up the concentration of cholesterol in all the HDL. And triglycerides are a storage form of fat, which is also carried in some of the cholesterol molecules, more in VLDL and another molecule called chylomicrons. We're not going to talk about triglycerides because everybody agrees high triglycerides, high risk of heart attack. Nobody's arguing. You don't want high triglycerides. Okay. So this is to clarify whether you've understood what I've said. What causes traffic jams and car accidents? Cars or passengers? It's more cars on the road. Think about it. If you've got chock-a-block full of cars on the road, that's what's going to cause the accident. It doesn't matter how many people are sitting in the car. It's the number of cars that are going to cause the accidents. This is important because what you're measuring when you're measuring your LDL cholesterol is how many passengers there are. That doesn't determine the number of accidents. What we need to know is how many LDL cars there are. And now we have a test that measures that, and it's called the APOB. It's a blood test. APOB is short for apolipoprotein B100, but everyone just calls it APOB. And basically, this protein is found on every LDL molecule. It's not a molecule. Yeah, every LDL complex. It's found on every VLDL and it's found on every IDL. So it is more accurate. It's telling you all the cars that tend to cause accidents. You are counting them all up. That is the biggest predictor of whether or not you will have atherosclerosis, heart attack, or stroke. And this test is covered by Medicare. It's free. And I don't understand. We are wasting our time measuring LDLC. We should be measuring ApoB, because LDLC, remember what I said, you could have lots of passengers but few cars, or you could have lots of cars and few passengers. And it's the lots of cars that are the problem. Does that make sense? Can I just have a hands up, and Craig, you tell me, do you understand why now? I don't want you to stress if you have a high blood cholesterol. I want you to go to your doctor and say, thank you. I understand that traditionally we feared that LDL cholesterol, high LDL cholesterol was a problem, but I'm aware that it's actually a high ApoB that's the problem. Could you please order an ApoB test for me?
Got a couple here just saying they don't understand 100%.
Okay. Re-listen to this webinar. It is a really hard concept to explain.
Okay. I actually think you've explained it quite well, Helena, though. I think that the differentiation between a car is the transport of the cholesterol. It's carrying the cholesterol around the body, and it's the potential of those cars having an accident.
Yeah.
That is the issue, not how many passengers are in that car.
Correct. Now, there's one more factor that can cause accidents. Cars that tow caravans are more accident prone. And there is one more protein that you might be unlucky enough to have inherited, which acts like a caravan. It attaches to your LDL cholesterol molecule, and it's like this caravan that's just badly attached and goes banging around, and it makes it even more likely that you're going to have an accident. And that caravan, I'm sorry about the names, I didn't make them up, okay? This particular protein is called apolipoprotein little a. That's just what they've called it. And it attaches to the protein ApoB to form an entity called lipoprotein little a, abbreviated LP little a. I know that sounds confusing and complicated, and it is. All you need to remember is if your LDL cholesterol has an extra protein attached to it, It is then called lipoprotein little a, LP little a, and that, if you've got a lot of caravans, that will triple, quadruple your risk of a heart attack before the age of 45, 50. Now, if you have inherited this LP little a, you're probably going to know about it because there's going to be someone in your family, whether it's a brother, a sister, a mother, a father, a grandparent. Well, you'll have a family history of people dying young of heart attacks, and yet they were looked as healthy as anything. Now, you're going to ask me, or I think you should ask me, if you have LP little a, is there a test? Firstly, yes, there is. You just ask, when you're asking your doctor for the APOB test, you can go, and while you're there, can you please order an LP little a test? It will cost you, but I think only about $50. And I think it's worth having because you only need it once in your life because you either inherit it or you don't. It doesn't change throughout life or very, very little. The bad news is there's nothing we know so far that can lower, reduce, remove this LP little a. So if you've got it, you are at a higher risk of heart disease. I'm sorry, I have to qualify this as well. There are different LP little a proteins around, and some caravans are built better than others. So some caravans are more likely to cause accidents than others. However, the majority of cars with caravans are bad news. Just remember that. So does that mean having high numbers of LP little a mean you're doomed? No. Just as even having high APOB doesn't mean you're doomed, because all these things are simply measures of your risk of heart disease. And just because you have a risk of something doesn't mean you'll get it. You could have bad roads, you could have lots of cars on the roads, and you could have lots of rogue caravans, but you still could get lucky and not have any car accidents happening on that road. But what it does mean is control the things you can. You can eat, you can lower the sugar that you eat, you can exercise, you can sleep better, you can reduce your stress, you can not smoke, you can not drink to excess. Go back and read all those things that I said, raised LDL cholesterol, and because that's actually the same as saying raised ApoB, but you know why that's an abbreviation now. So look at all the things that I've mentioned that raise LDL cholesterol and attack those things that you can control. And you might say, I don't want to know if I've got LP little a. That's fine. I do, because it means I'm going to take any chest pain, for tiredness, I've just got a sore neck. I'm going to take that very seriously, because if I've got LP little a, there's a high chance that that's symptoms of a heart attack rather than just indigestion or feeling under the weather. Personally, I like to know. So in summary, these are the most useful blood tests to ask for your doctor. Personally, I wouldn't order total cholesterol, LDL cholesterol, HDL cholesterol. I wouldn't order them. The reason I order them is because I have to, because the guidelines tell me I have to order them for a person. However, instead, ask your doctor, I want ApoB, I want LP little a. You're going to get your triglycerides. Now, I mentioned non-LDL cholesterol because it's becoming trendy, and you might be able to guess what non-LDH cholesterol is. It is the concentration of all the cholesterol in your blood that's not on HDL, but is on all the atherogenic lipoproteins. So it's LDL cholesterol plus IDL cholesterol plus VLDL cholesterol, and that more closely approximates ApoB and is more predictive of a high risk of heart disease than is LDL cholesterol by itself. Does that make sense? So your doctor will be familiar with non-HDLC, but I want you to say, I get it, order that if you like, because you know what that's about, but I still want my ApoB because it is more accurate in predicting my heart disease than is non-HDLC. Okay, now I'm just going to fly through. I'm going to check the time. Okay, I'm out of time, but I will fly through and answer the rest of your questions because they're really good questions and they're really important. I had one question, does being overweight make it more likely you will have cholesterol problems? Yes, carrying excess visceral fat increases your ApoB, I'm going to call it LDLC, but you know that I actually mean ApoB. So having a wider waist circumference. Try and get your waist circumference below 92 centimeters if you're a man and below 80 centimeters if you're a woman. That will lower your LDL cholesterol. I was also asked about getting a blood calcium test or coronary artery calcium score. Firstly, they're two completely different things. A blood calcium test has nothing at all to do with heart disease. So forget that. A coronary artery calcium score is a CT scan that identifies if there's any calcium in your artery wall. There should be none. Your coronary artery calcium score should be 0. Your arteries, when you are born, have no calcium in them. But if you've had LDLs crash into your artery walls, and if there's been a pileup, then calcium will start to build up in your artery wall. It's part of the process. So if you get a coronary artery calcium score and it is high, what it indicates is there have been car accidents. So it's up to you. It basically, tells you that there has been damage to your arteries. Will you have a heart attack? I still don't know. It's still another piece of information that tells me whether your risk is high. If you've got a road where with a record of a lot of car accidents, chances are they're going to continue to be car accidents, and chances are one of them's going to be fatal. So I would like to know my coronary artery calcium score, because that tells me whether I've had accidents. And, again, it's more information on whether I've, that I have to look after my arteries. And so yeah, the thing with this, you just have to have the test once, because if you've got a coronary artery calcium score of 100, you've had accidents. You don't need to be tested again to be told that you've had accidents. And if it's 0, midlife, by 40, 50, 60, unlikely to change much. You're not going to suddenly start building up calcium after that. Okay, so that was a question. Now, another question was, is a CRP test a good idea? CRP stands for C-reactive protein. And I know where this came from. I'm not going to mention the blogger that you probably read, the person asking the question. Well, not just the blogger, but people are going, no. It's all about inflammation. Inflammation is the cause of heart disease. Inflammation is another contributing factor to heart disease. CRP stands for C-reactive protein, which is a protein that goes sky high when you have infection or inflammation somewhere in your body. Heart disease, however, is a case of low-grade inflammation. So having a CRP test is useless, because who in hell knows why it's, firstly, if it's really sky high, it's generally not heart disease. It's going to be something like arthritis or an infection or an autoimmune disease. It's going to be high for some big inflammatory reason, not for a low-grade inflammatory reason like heart disease. So instead, you can order a HS, high sensitivity CRP test. Now, this measures very low levels of inflammation. And if you do have very low levels of inflammation, maybe that's due to inflammation in your artery walls. But I'm still not sure. And I personally don't want to order it, because it's kind of too sensitive. First, you've got to have 2 tests, and you either take the lower of the 2 or the average of the 2. You can't be unwell. If you've even got the sniffles or a flu or some infection you're not aware of, it's going to bump up the score. And I just think it's unnecessary worry, because your doctor will say, if you're in the highest 20% of people, if your score is in the top 20%, you've got double the risk of having, a heart disease or a heart attack. Yeah, but I just think it's not a really specific or accurate test. So there are a lot of people and doctors going, yep, have this test. Personally, I just don't think it's sensitive enough. It doesn't give me enough specific information. But it was a question I was asked. It was a good question. Which supplements lower LDL cholesterol? Now, this I could spend another webinar on each supplement. I won't. I'm just going to list the ones that I was asked about, and I'll just tell you the answer. Okay, fish oil. This is so controversial, it's not funny. There are some people that think fish oil should be in the drinking water because EPA and DHA, which are two omega-3 fatty acids, are just so important for the functioning of our brain, our cells, our heart. Yet, and people with a high fatty fish diet have a lower risk of heart disease for many reasons. One, fish oil thins your blood, so you're less likely to get a blood clot. Fish oil also tends to, in some cases, will lower your triglycerides, which is the other fat that we don't want. But the bottom line is, it's not conclusive. Some people do find that their risk of heart disease lowers and some don't. But a really big, most recent study, it was over many countries, tens of thousands of people, and they found that it didn't make an iota of difference, but it was only looking at people who were at high risk. Why would you test anyone else? It didn't make any difference, and it increased the risk of a heart rhythm called atrial fibrillation, which you don't want to have because it's an abnormal rhythm and it can lead to bigger problems. So I don't recommend fish oil. Flaxseed oil has not been studied as extensively. It's a different omega-3 fatty acid. It's, by all means, eat flaxseed oil, drizzle it over your salads. These are eat fish, eat flaxseed oil, but don't take the supplements. I believe they're a waste of time because the evidence just isn't there. Cholesterol lowering margarines just belong in the bin. They are, because even though some of them will lower your LDL cholesterol, that's not what we're trying to do. We're trying to prolong life and prevent disease. And even if cholesterol lowering margarines may lower cholesterol in your blood, they're going to give you disease in other ways. Steer clear of them. Zinc is another difficult one. Some studies say it lowers cholesterol and raises HDL cholesterol, and some studies say it do nothing. And basically, I mean, I've trawled through 50 studies, just inconclusive. So I wouldn't waste my time on zinc. I don't take supplements because overdosing is just as bad. And the bergamot, which it's a fruit, it's actually used in perfume. It's like a cross between a lemon, lime, orange. And there's been claims that it helps to lower cholesterol because it works in the same way as a statin. If it works in the same way as a statin, then it has the same side effects. And I have read reports that it can also increase muscle pains and cause muscle problems. So personally, I wouldn't take any of them. I would not take any of them. Don't waste your money. Focus on the other lifestyle factors that I've already talked about. So if you're trying to work this out for yourself, when someone tells you that a supplement lowers cholesterol, ask them the following question. Does this supplement lower ApoB? And if they glaze over and have no idea what you're talking about, they have no idea what they're talking about. They don't know whether it lowers ApoB. If they don't know what ApoB is, they don't know enough about cholesterol to be advising you about anything. And secondly, if they say, yes, it does, say, what's the mechanism by which it lowers ApoB? And if they can't give you a good explanation how it does that, they don't know what they're talking about. And thirdly, who funded the study? Because I can tell you all the supplement studies funded by the company that makes the supplement gets positive results. Wow. And then all the independent studies don't necessarily get positive results. Now, just to close, to add to the complexity, there are, I mentioned, subtypes of HDL, subtypes of Lp(a), subtypes of LDL, and we're still sorting out what they all do. But I've told you the main important things. So the other thing too, it's not as simple as some of you will have heard of small dense LDL. So little cars are more likely to have accidents than big cars. There seems to be a trend that way, but it's not as simple as that because not all the studies show that that's actually the case. So the tests that I've told you are more important and better at identifying your risk than because you can get a test that tells you the size of your LDL particles. That was what we used to do a couple of years ago. We're now going off that. So if a health practitioner tells you that cholesterol is a simple issue, leave their office immediately, because now you can see it is so not. And finally, statins are a big question. What are statins? Statins are one of 4 medications that can lower LDL cholesterol, and actually that can lower APOB. And there's one more drug that can lower triglycerides, but there are 4 classes of drugs that can lower LDL cholesterol. The most common and the most effective are your statins. And they do this by blocking an enzyme in the liver called HMG-CoA reductase that makes cholesterol. So the liver makes less cholesterol. But the main way that statins work are not because they lower the amount of cholesterol that your liver produces. It's because if your liver is producing less cholesterol, it removes more of your LDL cars from circulation because it needs them, because it's not making them. So that's why statins are powerful. Now, are they good or bad? Because they can cause muscle aches and pains. They can cause joint pain. They can make people feel awful. Yes, all medications have side effects. And I'm the last person to go pushing drugs. But statins can lower the risk of heart disease. There's no 2 ways about that. So if I have a patient that is sky high ApoB, I would be negligent not to start them on a statin. So then it's not they're either good or bad. They help in lowering ApoB. They help in lowering the number of cars on the road. They help in reducing the risk of car accidents. And sometimes there are side effects, and sometimes in some people there are not. Now, what about the brain? Well, turns out that if you have, there are some statins, and there's 7 different statins on the market. Some statins can dissolve in water, and some statins dissolve in fat. Those statins that dissolve in fat are slightly more likely to sneak through that blood-brain barrier, we think, and slightly more likely to affect the brain. So some statins affect the brain, some do not. But the more important thing too is if you've got a leaky blood-brain barrier, if there's been some damage to that wall, which can happen with infections or Alzheimer's or various diseases, if you've got even bullying and stress can damage that barrier between your brain and your blood, then statins are more likely to enter and can lower the production of cholesterol in your brain as well, which you don't want. So it's a case of, if you are prescribed a statin and if it's absolutely necessary, ask for a comprehensive memory test beforehand. I want my memory check before, and I want my memory check 3 months later, because I want to see if it's affecting my brain. And also do liver function tests, kidney function tests, monitor for other side effects, because all drugs have side effects, and sometimes the good outweighs the bad, and sometimes it doesn't. There is no one way for everybody. No one size fits everybody. So I know it was complicated and complex, but did you find this useful? Last poll, please. And re-listen to this over and over again. Like, this is 10 years worth of study in 50 minutes. Because the other thing too, there's so many words you've never heard before: ApoB, LP(a), particle numbers, atherogenesis. They're all new words. This is anonymous, so please be honest, because that teaches me whether I have taught, if I have to teach it in a better way. Too complex, challenging, but I followed most of it. Pitch adjuster, other. Well, I'm so pleased that it wasn't irrelevant. If you said too complex and hard to understand, I get it. Just watch it again and again and pause and take it in, because it is really important. Or at least just focus on the easy slides and then just add to your information. Any
So
more
Helena, we've got, oh my God, Helena, you're on fire tonight. Great info. How much does a CAC test cost?
It's not covered by Medicare.
No.
And also be aware, don't have it if you're pregnant, because you are getting about 5 times the radiation in an X-ray. Just be aware of that. It's a CT scan. It's only a few minutes. Depends on the lab. I'd start at $150.
I got a feeling I paid $200. I got mine done not last year, the year before. I think it was about $200.
I would say between $150 and $300, depending on the lab.
Okay. Are antidepressants protective?
Sorry, I'm just got to let me see if I can see the questions myself. What do I? Sorry, let me just chat. Okay, that way. Say that again. Are antidepressants protective?
Yes.
Yes, they can be. Yes.
Okay. What about someone who has no thyroid removed because of cancer?
Okay, as long as
the thyroid medication. Yeah,
thyroid medication will cure any risks in terms of raising your APOB. I'm going to be precise, LDL cholesterol. So yeah, as long as you get your thyroid treated, it's fine.
How much sugar is okay?
The recommendations say for women, 6 teaspoons of added sugar per day. You don't count the sugar in your fruit, vegetables, or any of that, but you do count the sugar in your orange juice and in your flavored yogurts, flavored milk. So 6 teaspoons of added sugar for a woman and 8 to 9 teaspoons of added sugar for a man. 1 teaspoon, 4 grams. So 6 4 is 24 grams of added sugar for a woman. And I say that because the back of a packet of something like your pasta sauce or your salad dressing or your breakfast cereal is going to give you the grams. 24 grams tops for a woman and 32, 36 grams for a man.
So if the recommended tests you mentioned have high/concerning results, then where to from there if the doctor isn't on board with current testing?
Okay, you need to go to a cardiologist.
Right.
Oh, sorry. Are you saying you've had the tests?
No, I'm reading this. So if the recommended test you mentioned.
Okay. So if you have a high ApoB and a high Lp(a) and high triglycerides, put it this way. If you're more than likely going to have high non-HDL cholesterol, it's unlikely that the doctor's not going to treat you in some way. And they're going to put you on statins. If you've got a high ApoB, no questions asked, you'll be put on statins. Now, you can try the lifestyle measures that I mentioned. It depends how high the number is and what other risk factors you have. So, okay, this is why it's good to have more than one test. So if you have high ApoB, then I would go and have my coronary artery, my CAC, my coronary artery calcium. So you know if you've already had some accidents. So if you've got a high ApoB and a high CAC, I would put you on cholesterol because I would just be too terrified not to. I just think you're at a very high risk. Okay. So you need to have a GP that works with a cardiologist, and statins aren't the only medications. You'll probably actually be put on 2, maybe even 3 medications. You know that I'm the last person to put people on meds, but if you are unlucky and you've just inherited a vascular system that is putting you at risk, I'd take the medication, but not unless I would get I would, give you, check if you had sleep apnea. I would talk about your stress levels. I would talk about your relationships because, relationship stress, distress will increase, the damage to your artery. So I would go through all those lifestyle factors, and I would also probably start you on a medication. And then maybe if things are really well controlled, we can lower the medication. If we treat your sleep apnea and we fix your thyroid and we do all those, if you've got kidney disease or liver disease, or if you're drinking too much. Yeah.
Okay. Helena, that's all we have. There's no further questions. So thank you so much. I found that to be incredible tonight.
Oh, thank you.
So well done. And thank you everyone for coming along.